Hello, I'm Emee and welcome to the second part of this webcast on qualitative research and social impact. What can we learn from action research? Earlier, we already discussed the importance of recognizing our qualitative skills and also generating supporting evidence to support our claims. In this part, we are going to talk about the importance of involving your participants and developing opportunities to enable them to take ownership of the project. And when we talk about participant engagement, it's not just about interviewing your participants or collecting data from them. No, this is more about involving your participants in the stages of your research, from forming the questions, designing the methods, collecting and analyzing data with them, implementing and monitoring action, evaluating the changes that you've done, and also disseminating the process and outcomes of your work. Now, we know that participant engagement is useful because, first of all, it is a way to generate meaningful and in-depth information for your research. At the same time, it also enables your participants to steer the direction and focus of the project and also gives them the opportunity to recognize and develop their skills through their involvement in your research project. Now, I will show you some examples of how this might work in practice, and I will draw upon my own experience of facilitating an action research project with migrant nurses in the UK. Now, this particular project aimed to explore the subjective experiences of migrant nurses in the UK, and again, we tried to frame it within an action research agenda designed to inform and influence potential plans to address emerging issues. Now, we conducted this project in 4 stages. The first stage is to establish rapport and to plan the project with the participants. And then we tried to compile insights and their experiences of working and living in the UK. And then once we've compiled those insights, we tried to analyze and synthesize this information before we disseminated and reflected upon the next steps in the process. So, for this particular project, we encouraged our participants to keep a reflective diary for a period of 6 weeks so they could reflect and record their experiences of living and working as a migrant nurse in the UK. Once they've compiled their insights in the diaries, we tried to discuss these with the participants by organizing a World Cafe event wherein they brought their diaries with them and they shared their thoughts and ideas and insights that they recorded from their diaries. Insights from the research were also shared to a wider audience through a stakeholder event, obviously with the permission of the participants, and the participants were also actively involved in organizing this event. Some of the key issues that came up from the diaries in the World Cafe were presented, and the next action steps were discussed in that event. As you can see here, a poster was organized to show some of the key activities that we did during the research, and also highlighted some of the themes that came out from their diaries, including some of their feelings about coming here to the UK, all their feelings of being scared sometimes, or sense of fulfillment, being accepted, and so on. They disclosed feeling homesick at times, some of the burden that they had to deal with while working in the NHS, some of the paperwork and having to deal with patients and staffing issues, and some of the structural changes. Many of them, they said that it was a mixed bag. There were some good and not so good experiences, and they felt really comfortable sharing these experiences in a safe environment that we have in this research. They also talked about some of the organizational issues, the fantastic leadership and support that they've received in the NHS, but also they raised issues around language. Sometimes they said that they couldn't understand the British accent, or they also couldn't understand the British humor at times. As you can see in this poster, there are some case studies included in here, again with the permission of the participants, and the participants actually wanted their cases to be included in this poster because they want their experiences to be heard and to be shared to a wider audience. They also shared their thoughts about the work-life balance and how they cope with the pressure of working in the NHS and also trying to balance family life here in the UK. At times, some of the themes that came up were also around racial microaggression. And if we try to define what we mean by racial microaggression, this is basically brief and commonplace daily verbal, behavioral, or environmental indignities. This could be intentional or unintentional, but these behavior and environmental issues are communicated aggressively with derogatory or negative racial slights and insults. And this is actually one of the key themes that came out in this project. The nurses discussed their experiences of feeling bullied, their experiences of being downgraded and unfairly treated. They also shared some of their experiences of the barriers to progression and promotion, how some patients preferred white nurses rather than migrant nurses. Sometimes they felt unsupported, but in the end they just tried to cope with it and felt that they have to be defiant when it comes to racial microaggression. Now, the interesting thing about this is that racial microaggression wasn't really the original focus of the project. The project really just wanted to look at life and in living in working as a migrant nurse in the UK. But because racial microaggression was an issue that was highlighted in the diaries and in the World Cafe, it became a very strong focus and really discussed heavily in the final report of this project. And because the participants were given a safe and confidential space to share their stories, this project enabled the participants to actually steer the focus of the study so that we could highlight matters that were most important to them. So by giving the participants ownership, if you like, of the project, they took the steer and focused it to what's important to them. So that is one experience. Another experience that I would like to share is my work on the alternative learning system with the Ayta community in the Philippines. And this is something that I worked on while I was doing my PhD at City University in London. Now, the background for this research was based on initial discussions and conceptualizations among critical health psychologists regarding the need for our field to move towards greater practice and action orientation. And these discussions in the literature actually made me think about how I could use my research to help communities, especially those who are considered marginalized and disadvantaged. Now, I started this work by contacting relevant organizations that I can potentially collaborate with. And I ended up working with an organization called the Popular Education for People's Empowerment. And at that time, they were working with the indigenous Ayta community in Pampanga, who are the earliest inhabitants in the Philippines. It's a relatively small minority group in the Philippines. It's about 0.18% of the entire Filipino population. In recent years, the Aytas living in the mountainous areas of Zambales and Pampanga have become increasingly marginalized because of the destructive volcanic eruption of Mount Pinatubo in 1991. And we try to work with them closely because many of them lack the formal education, and this makes them vulnerable from economic exploitation. Now, for this particular project, we had 7 stages. Again, you can see we tried to establish rapport and plan the project with them. We generated insights with them, validated the information with them, had some recommendations for action and planning workshops, tried to implement the interventions, and had some evaluation and follow-up. Now, as you can see here in the action research stages, when we tried to establish rapport and planning, as you can see, we did hold community visits and community workshops to discuss the project with the participants so they can shape the nature and scope of this research. And their idea really was to aim for development and use education that integrates culture, livelihood, and health to achieve this development. And we are using participatory action research to forward this agenda. In terms of generating knowledge with the community, several workshops were held, including a structures of trade workshop to look at how they traded and how they lived in their communities. We had structural, social structure workshops, institutional diagramming workshops. We had several focus group discussions as we visited their homes. We had interviews, photo and video collections, and informal storytelling with the tribe members. After generating the insights, we tried to validate the data and organized a workshop to raise their recommendations on what we need to do about the issues that were raised from the research. A community meeting was held wherein 60 or so individuals took part. We had local residents, visitors, traders, teachers, volunteers, and leaders who took part. And by the end of this workshop, an action matrix was developed to discuss what needs to be done, what are the priorities, who's going to do it, what are the barriers and opportunities that we already have in the time frame by which we need to complete the action. As you can see here, we had a very detailed planning for action implementation workshop wherein we discussed the key priorities, who's going to do it, and the target dates. And in the end, the plan was to implement action shortly after the planning stages, and I will go back to the field later that year to follow up and ensure that the program is properly monitored and evaluated. While that's going on in the field, I also plan to go back to my desk, as this was part of my PhD, to look into the data, write it up, and disseminate it, and do a bit of advocacy work on the side to raise wider awareness and also to raise some funds to support the alternative learning system with the tribe. This was the plan anyway, but I would like you to hold on to that thought for now. We will get back to what actually happened later on in the presentation, but just hold on to that thought for a while. But the main point that I'm trying to make here really was the importance of involving your participants in the process. It was useful for both researchers and participants because the project itself was being steered by the real experts in this topic, and the real experts are the people who are living in these circumstances. Also, by involving your participants in the process, they are also recognizing that, look, we can actually do something about our situation. We have a voice, we have skills, and we are doing it ourselves. So, in a way, it is beneficial because it encourages the community to engage in discussions concerning these issues, be involved in action, and really take part and do something about it.